Okay, fine. So, good evening, everyone. In this videos, I am going to talk on another important information related to COVID-19. Particularly, I am going to talk on post-COVID-19 infections. As you know, the patients who are recovered from the COVID-19 infections, they are complaining of headache, some are complaining of fever, some are complaining of rashes, some are complaining of their loss of taste and smell is still persistent, it's not recovered. So depending upon the symptoms of the patients, you have to give the treatment accordingly. But one thing one thing which I would like to clear, that these patients who are recovered from the COVID-19 infections, they will not get this infection again. So don't worry about it, but you have to take the treatment according to your symptoms. So if suppose after COVID-19, depending upon the individual or symptoms, if someone is saying their redness of eyes or ear problems, so accordingly you have to give the eye drops or ear drops, or you have to consult with the physicians for that particular symptom. If you are if patients are complaining there is a loss of taste and smell after the recovery of COVID-19 infections, it can be, and these all symptoms can be persist for 2 to 3 months also, depending upon the individual. Maybe some individual will not get any symptoms, some will get such type of symptoms. So these loss of taste and smells are not a major symptoms. These most of the cases these can be regained it again. Some patients are saying after post COVID-19 they are getting a sneezing, so in that case you have to give antihistaminic. Some patients are getting throat problems, so you have to use honey, lime or steam, it could help. Some are saying they are feeling acidity problem, so you have to do the treatment for acidity. The drugs which are available like antihistaminic, proton pump inhibitors, you have to give that particular patients. Some patients are feeling congestions in the pulmonary, or some patients are asthmatics, they have to take their inhaler. Some patients are complaining of diarrhea, and diarrhea is coming or going, so you have to give ORS or probiotics or treatment for the diarrhea you have to give. Some patients might get some minor rashes, so most of the time these rashes, if they are minor, it can be recovered by themselves, so there is no need of treatment. Some patients are complaining their fever is coming again and again in post COVID-19, and when they are taking the paracetamol, this fever is not decreased. The reason is, as you know, this paracetamol is antipyretic but weak anti-inflammatory agents, and in COVID-19 inflammation in the body is high, so you have to use anti-inflammatory drugs also. You can use mefenamic acid, naproxen, indomethacin, etc. So it will help to decrease the fever as well as the inflammations. So some cases paracetamol will not work in COVID-19. So some patients are complaining they are getting a fever, they are taking the paracetamol and their fever is not decreasing. So you have to take anti-inflammatory drugs also. Some are complaining of muscular pain, so you have to give treatment for the muscular pain. So depending upon the symptoms of the patients after post COVID-19 infections, you have to give the treatment. As I told, these symptoms might be for 1 or 2 months or 3 months, up to 3 months you can get. Some symptoms you will get in 1 week and another week, or after 1 week or 2 weeks or 3 weeks, it can be happens. So don't worry about this. You have to take the treatment according to your symptoms. Thank you.